Okay, here we are back. Now we're going to start to talk about the female reproductive system. We finished the male, and now let's talk about the female. So here's our outline. We'll talk about the anatomy, we'll talk about how the egg is produced, and of course the sexual cycle. And we'll talk for a moment or two about pregnancy and childbirth. But as I said before, there's just not a lot of time to cover all of these things, so we're not going to be covering much about pregnancy and childbirth. All right. So we've already established that the female reproductive anatomy is much more complex than the male, not because women are more complex as beings, but just because they have more to do. So here are the functions for the female. Not only do they have to produce the egg and then deliver it to the uterine tube, but if the egg is fertilized by the sperm, then they have to nurture that developing embryo and fetus, which is a lot of work. Then they've got to push the baby out, and then even after pregnancy, they have to nourish the infant through breast milk. So it's a lot to do, and the anatomy reflects that. Okay, we've already defined primary sex organ, which for the female is the ovary, and a primary sex organ is a sex organ that produces the sex cell, which of course for the female is the egg. There are a bunch of secondary sex organs, which will cover some of these, but not all of them. Okay, let's start going through the anatomy. Let's just jump right in. Okay, so here's pretty much an anterior view, and we can start with the ovaries. So the ovaries are these yellowish balls. This is, of course, the female primary reproductive organ because it produces the egg. So the ovary, know where it is. We know that its function is to produce the egg. And of course, along with that, there's going to be a production of sex hormones, primarily estrogen, progesterone, and a little bit of testosterone. We can see that these organs are paired, one on each side, and they're held in place by a ligament, but you don't need to know that ligament. They're showing you here the ligament, the suspensory ligament, but you don't need to know that. Very straightforward. Here's a lateral view on the left, and I don't want to make a joke about it, but let's just be honest. Women have 3 holes down there, so to speak. So the most anterior hole or opening is going to be the urethra. So if you look at this picture, here's the bladder, and coming out of the bladder is the urethra, which is of course going to be our excretion point for urine. If we go to the second hole, let's change color. Here's where we have the reproductive organ. So this is kind of an odd view, but the uterus is the star of the show because it's the biggest. Here's the ovary up here. And what we're going to find out, and you probably already know, is that we have the vagina, which is both the receipt for the penis and the exit, for childbirth, the birth canal. And then, most posteriorly, would be the digestive hole. So we have the last part of the large intestine, the rectum, and then the anus there. Okay, just want to make sure that we're clear. Let's go back to green. Here's a nice up-close look at the ovary. And what we're going to find out later in this lecture is that every month, once per month, each ovary produces 1 egg. And we're going to go through that as a process. And we can see we have these little follicles. And we'll talk about this later, but just to give you an idea, inside the ovary, the developing oocyte or egg is surrounded by a little follicle. And as the egg grows, the surrounding follicle gets bigger to help nourish that developing oocyte or egg until eventually we have a mature egg. That mature egg will be released That's what ovulation is when the egg is released. And then we're also going to talk about a second function of the ovary, which is to produce something called the corpus luteum. And that's going to be what releases hormones. And what we're going to see is we can almost divide this function in half. So the first half of the month, or the first half of the sexual cycle, the ovarian cycle, the first half of the month is when the ovary is busy producing the egg. At the midway throughout the sexual cycle of the month, the egg is released. And then the second half of the month, the ovary is busy producing this structure called the corpus luteum, which produces the sex hormones. This is different from the male. So the male, we talked about sperm production in the seminiferous tubules of the testes. Once puberty hits, the testes are going to produce sperm all the time. Produce sperm, produce sperm, produce sperm. It is different for the female. After puberty, egg production will begin, but it's only one egg produced per ovary per month. It's not an unlimited supply. There's some other structures in the ovary, but you do not have to know all of these. Similar to other organs, we have an outer region called the cortex and an inner region called the medulla. I'm not going to ask you that because it's not really that pertinent to our discussion. However, I do want to point out the follicles, which I already mentioned. So these are the surrounding structures that help to develop the egg. They change names based on different periods of time, primary, secondary, and so forth. And you can see that they help to mature the developing oocyte. An oocyte is the name for the developing egg. It's not yet mature yet. Nice and straightforward. Okay, so moving along, after the ovaries produce the egg is released at ovulation, and then the next place that egg is going to travel is into the uterine tubes, sometimes called the fallopian tubes. So the egg is released at ovulation, and then it travels through the uterine tubes, eventually making its way into the uterus. The uterine tube is lined with smooth muscle, which helps to push the egg along. The uterine tube is lined with cilia. So here's a difference, right? The sperm has a tail, and we add some fluid to it to produce semen. So the mode of transport for sperm is to swim because it's got the egg. So it's got the tail. An egg does not have a tail, so there's got to be a different mode of transport. And this is similar to what we talked about in the respiratory system when we talked about the cilia in the trachea. So what happens is all of the cilia move in one direction at one time, and that moves the egg along the uterine tube. Functionally, not only is this the site of transport for the egg from the ovary to the uterus, but it is also the site of fertilization. So if that sperm, wrong button there. Let me change color. Let's see. Let's do white, I like that. If the sperm makes its way up, it's got to come all the way into the uterine tube. And this is where fertilization would happen. Now, of course, if the egg is fertilized, it's not going to stay in the uterine tube, but this is the site of fertilization. Okay, last thing to point out here, let me go back to the green. Last thing to point out here is that the uterine tubes more or less have to catch the oocyte. So there are these things dangling down called fimbriae. And that's going to be on the next slide here. So I'd like you to know what the fimbriae are. Fimbriae. Those are these little extensions that dangle down. So what happens is we're going to find out that there's all sorts of impediments that can make the job of the egg production and transport in the female more difficult. So it's a touchy process. So in other words, it's not guaranteed and things can happen along the way. Versus the male, because we know that not all of the sperm is going to make its way up into the uterus and the uterine tube, the male produce a ton of sperm. We'll discuss that later. I'm getting ahead of myself. But these fimbriae, so what happens is, when the egg is released, it's just kind of dumped out. And it is the job of the fimbriae to more or less catch it. So those extensions are sticky. And as those extensions or the fimbriae drape down, it is the job of those fimbriae extensions to catch the egg that has been released from the ovary. You can imagine, if you could see me right now, I'm making a little motion with my fingers like the fimbriae trying to catch the ovary, the egg. And this happens most of the time, but it can be a tricky process. So hopefully these fimbriae catch the egg and bring it into the uterine tube. There's other parts of the uterine tube named by the region, but you do not have to know those parts. Only have to know what we're talking about. Here's a nice picture of that epithelial lining. So as I said, the mode of transport for the egg is that all the cilia move in one direction at the same time. Looks pretty much like the trachea, doesn't it? All right. Then we get to the uterus. Uterus is a big pear-shaped organ. This whole thing is the uterus. All right. Let's see. What else do we want to know? What are the functions? Well, the functions of the uterus are to receive the egg and hopefully nourish a fertilized egg. So it's going to receive the egg, and it's hopeful that that egg is fertilized, meaning that the sperm made its way up. And of course, the site of fertilization is in the uterine tube. But if there's fertilization in the uterine tube, then that fertilized egg comes to the uterus, and that fertilized egg will implant itself in the uterine wall. So it receives the egg, but really it's hoping to receive the fertilized egg. And if that egg is fertilized, meaning that the sperm met it in the uterine tube and now it is a fertilized egg, if that happens, then that fertilized egg will implant in the uterine wall. And of course, this is where the developing fetus will develop. And it can do that because the uterus is designed for that. It's big, it can stretch, and it has everything that it needs. Now, if the egg is fertilized, it will implant in the uterine wall. But what if the egg is not fertilized? Can I erase this? Oh, it's a slow process. If that egg is not fertilized, if it's just the egg hanging out solo and it's not fertilized, what's going to happen to the egg? I can hear you because I know you're thinking along with me. You're with me. If the egg is not fertilized, the egg will just be released during the menses or the period. So if the egg is not fertilized, it will just be released. But if the egg is fertilized, oh, I can't go back now, but I can erase. Let's try it again there, doctor. I can't erase it. Okay. If the egg is fertilized, of course, it will implant itself on the wall. Okay, I made my point. Ooh, here's a real cadaver uterus. I know you're excited to see that. Probably not. What are the parts of the uterus? Well, it has a fundus, or the top mound part. It has a body, which is the middle part. And then I would like you to know all these. It has the cervix. The cervix is the opening at the bottom, which leads into the vagina. So we have the fundus, which is the round superior part. And we've seen the fundus before. We also saw a fundus in the stomach, which was the rounded top part. Has the fundus, it has the body, and then the cervix is the opening at the bottom into the vagina. So everyone's heard, oh, the cervix is dilated. So during childbirth, that cervix has to open or dilate to allow enough space for the baby to come out. So it's the opening between the uterus and the vagina, cervix. Okay, it is important that we talk specifically about the uterine wall. We know that there's muscle. There has to be muscle. Why? You got it, because during childbirth, we need a lot of muscle to push the baby out. And we also have to talk about the specialized inner lining called the endometrium. So that inner lining called the endometrium is specialized because this is where the fertilized egg will implant. So it's a specialized inner lining that is able to receive the fertilized egg and then help to develop it. If you've ever heard of a woman having endometriosis, it is a condition where this inner lining is inflamed. It can result in quite a lot of pain and some dysfunction. I usually like to make the men feel uncomfortable. I think I may have talked about this in A&P 1 if you had me when we were doing the tissue chapter. But, men, come on. They go and they poke and you have to cough. It's not really that difficult compared to the woman. Let's go back. This is my public service announcement so everybody can understand. When a woman goes for her annual exam to the gynecologist, let's do green. Woo! What they do is they put you on a table, the female, put your feet on the stirrups. They tell you to scoot down. Come on, ladies, they keep saying, scoot down, scoot down. So you don't think you can scoot down anymore. Your knees are bent as far as they can bend. And then they insert a cold speculum all the way down the vaginal tract. And they scrape away the inner tissue of the cervix. So imagine, gentlemen, putting a cold metal speculum pretty deep inside the woman, all the way up the vaginal tract to the cervix. And then they scrape some of that tissue to look at some of the cells in the cervix wall. Should look like on the left, but cervical cancer would look like on the right. Not on the test, just my little public service announcement to let everyone know what women go through. Okay, so we've talked about the ovary. Let's just review. We've talked about the ovary. The ovary is where the egg is produced. The egg then is transported through the uterine tube into the uterus. If the egg is fertilized, it will implant in the uterine wall. If the egg is not fertilized, it will just continue out. So no matter whether it's the unfertilized egg or whether it's the baby, the exit point is the vagina. So it's the birth canal. It's a muscular tube. It's got 3 layers to its wall, but what I want to point out is it has a specialized outer covering called the adventitia. We saw this in the digestive system. Certain organs of the digestive tract that are prone to a lot of friction, like the esophagus, have a thicker outer covering called the adventitia. Same thing here, because there's a lot of friction from pushing the baby out or from receiving the penis in, that outer covering have to be thicker. And those are its functions. It's the birth canal, so it's where the baby gets pushed out. Also, it's the exit point for menstrual fluid during menses. So those are the exit points. And it receives the penis. Okay. Here are some of the external genitalia. You do not have to know any of these. I have a picture here. It's actually the wrong picture. I should change it. There was an episode of Seinfeld, if those of you that are older like me, where Jerry dates a woman but doesn't know her name. And she gets mad because she thinks, well, we're dating, you should know my name. And to play a little difficult, she says, well, my name rhymes with a female reproductive organ. And the next morning, his guess for a woman's name that rhymes with the female genitalia, his guess is mulva, because it may rhyme with vulva. But he's wrong because her name was Dolores, which of course rhymes with clitoris. All right, let's talk about the mammary glands. They're present in both sexes. So men do have some mammary gland tissue. The Y got cut off there. But they're only functional in women. And of course, women are going to have more adipose tissue making up the breast. And then you can see here, there's suspensory ligaments that hold up the breast. Over time, these ligaments loosen because of the effects of gravity, years and years and years. And this is why, as women get older, their breasts tend to sag a little bit because there's weakening of the suspensory ligaments. And we can see the glands inside. So these pink little guys or girls are the glands. And what these mammary glands do, of course, is they produce milk. Let me make sure I underline that. So, okay. Here's a real sagittal section of a cadaver breast. A lot of adipose for protection. We can see some of the fibrous tissue on the inside. And the glands, they're hard to see because they're more or less microscopic, but the glands would be all in the inside here. Okay. All right. So once we've gotten through the anatomy of the female reproductive system, it's almost a longer discussion to talk about the female sexual cycle. So we're going to spend some time talking about the sexual cycle. This is much different from the male, because in the male, once a male hits puberty, then the testes produce sperm, good, great to go. Testes produce sperm 24/7, 365, right? Happens all the time. It's an ongoing thing. In the woman, it's much different. So we call this monthly cycle of event, overall it's called the sexual cycle. Sometimes you probably hear these terms interchanged, but I want to make sure that we're clear and we're using them properly. So the sexual cycle, it's not how many times a woman has sex a month, haha. What we're talking about is the sexual cycle is the monthly events that occur within the female reproductive system. That's how I would define it. Sexual cycle. The sexual cycle refers to the cycle of monthly events that occur within the female reproductive system. Sexual cycle. Series of events that occur monthly within the female reproductive system. Now, within the sexual cycle, we can talk about it in two parts. So within the sexual cycle, what's happening each month within the female reproductive system, we can talk about two parts. We have the ovarian cycle and the menstrual cycle. And these are really defined by the anatomy or the location. The ovarian cycle is what's happening in the ovaries, hence the name. So of the sexual cycle, of all the events that occur monthly in the female reproductive system, we can talk about a portion called the ovarian cycle. And what that means is we're talking about, during that month, what's happening in the ovaries. The menstrual cycle, on the other hand, is what's happening in the uterus. Now, once we've defined those terms, we already have begun to understand what's happening. Because if we talk about the ovarian cycle, well, what's happening in the ovaries? Well, they mature the egg. So what do the ovaries do? Produce and mature the egg. So if I was to define what are the events of the ovarian cycle, you would just think about, well, what does the ovary do? It produces and matures the egg. When we talk about the uterus, What is it doing each month? Well, the uterus each month thickens in preparation for a fertilized egg. So every month, what's happening in the uterus? It is thickening in preparation for the fertilized egg. Now, mind you, the ovarian cycle and menstrual cycle, they're happening at the same time. They don't do things in the same order, but it's not like the ovary does one thing and then stops, and then the uterus picks up and does something and then stops. Well, no, the ovary and the uterus are both active during the whole month, but we tend to talk about their functioning separately. And you'll see later I have a nice chart, because I love charts, that puts it all together for you. Now, we can also take this a step further, because what is, you see at the top here, it says oogenesis. Well, that is the term for production of the egg. So really, oogenesis is what the ovarian cycle is doing. That's just a name for it, oogenesis. Oogenesis, make sure I spell that right. What was the like-minded process in males to produce the sex cell? For them, it was spermatogenesis. So remember, genesis means to produce, or the origin of. So spermatogenesis is the production of sperm, and the prefix oo is the prefix for egg or ovum in the female. So therefore, oogenesis is the production of the egg in the female. All right, bear with me. So later, we're going to put it all together, and you can see we've got some slides that I'm probably going to skip a lot of them. But later, we're going to do a nice little chart. And I know you might be intimidated, but please don't be, because we're going to break it down into the most important things. So my suggestion to you would be to start with these definitions. Okay, so remember, different from a man produces sperm 24/7 after puberty, ongoing. In a woman, the events of egg production and the events of the reproductive system occur on a monthly cycle. So the events that occur within the female reproductive system, those monthly events, are called the sexual cycle. And within what's happening within the female each month, we can talk about two parts. We can talk about the ovarian cycle, or what's happening in the ovary, and we can talk about the menstrual cycle, or what's happening in the uterus. And they occur concurrently, but it helps us to understand it functionally, because what is the ovary doing? Well, we already know the ovary produces and develops the egg, which is called oogenesis. At the same time, what is the uterus doing? So the menstrual cycle, what is the uterus doing? It is thickening in preparation for the fertilized egg. I would start there. Here are a couple of notes, and I've already said a lot of this. Let's just make sure. Let me go back to green to try and be consistent. We know that in the female, the events of the reproductive system are monthly, whereas in the males, the events of their reproductive system are ongoing. Another difference, let's see here, maybe I can do a little chart. You know me. Let's do males and females. Maybe I should add a slide here that has a side-by-side comparison. So if we were to compare the reproductive systems, the males have an ongoing sperm production. 24/7, right? Whereas the females, it's not ongoing. They produce one egg per month, per ovary. Put a C in there. All right, so if we were to compare and contrast, we know that the male has an ongoing sperm production after puberty, of course, and the female, instead of it being ongoing egg production, they only produce one egg per ovary per month. What's another difference? Another difference Let me change color to make it a little bit easier to stand out. Another difference is that males continue this for a lifetime. So males will continue to produce sperm for as long as they're alive. Will their sperm production go down a little bit as they get older? Sure, it might. But they're going to produce sperm as long as they're alive. Women, the factory shuts down. So for women, we could say egg production ends at a certain time in a woman's life. For some reason, I'm blanking on what that's called, and I don't know why. Menopause, there we go. Jeez, maybe it's a sign of my own menopause. So the age at which a female's body will stop producing eggs differs. Maybe it's 50, maybe it's 60, maybe it's 70, I don't know. But that's a difference because males will continue to produce sperm forever, as long as they're alive, and females will produce eggs for a period of time, but then their egg production will stop at a certain age. All right, last difference I want to point out here is that we can see that in the female, their total supply of eggs is determined by birth. So in other words, the eggs they will produce the number of eggs that female will produce is determined at birth. And this is different from males because males will basically just keep producing. And I don't want to say it's unlimited, but it kind of is. We're going to find out that they produce millions of sperm each day. So in other words, males, they just keep producing sperm. There's really no cap. And it's not like the number of sperm a male is going to produce is determined at birth. In the female, based on genetics, the framework for how many eggs a woman will produce once she reaches puberty is already known at birth. So it's genetically decided. And this just means that some women genetically will produce more eggs, some will produce less eggs. So very different if we were to compare the males versus the females. Okay, much like we talked about with the males, we are not going to talk specifically about the process of egg production. Just like I said, you didn't have to know the specific steps of sperm production. There's a picture here. We can see that what I do want to point out. So you can see that some of the development of the egg, and of course the process of the egg development and maturation is called oogenesis. Some of this is beginning before birth. And that just goes along with what I said previously, that the framework for how many eggs a female will produce is genetically determined. So some of this initial framework is happening before birth. I'm not saying that the ovaries are producing eggs before birth, because that's not true. The ovaries are only going to start to produce eggs once puberty is reached and they have the hormone signaling. Don't fret too much about this, too much to know. Okay. But I do want to talk about the sexual cycle. This is pretty much our last topic. And it's kind of a big one, but I'm going to try and break it down into understandable pieces. So try not to be intimidated. Okay, so we already know that the overall monthly events occurring in the female is called the sexual cycle. Boom, got it. For most women, they'll say it averages 28 days, about a month. I'm a woman, it can vary. Sometimes it's 22, sometimes it's 31. You never know what's going to happen. Makes life pretty interesting. Not always fun, though. And we know that The monthly events can be broken down into the ovarian cycle, what's happening in the ovary, and the menstrual cycle, what's happening in the uterus. Boom, got it. We're going to first talk about the ovarian cycle. So we know what's happening in the ovary. The egg is being produced and matured. We're going to break the ovarian cycle into 2 phases. And that's more or less what I was talking about before. So if we have our ovary, remember I said we could break it down in half? Yes. So the first half would be the follicular phase. So if we were to follow the ovary each month in a female, we would see that the first half of the month, what we're going to call the follicular phase, we have that developing oocyte surrounded by follicles. And it keeps getting bigger and bigger, right? It's called the follicular phase because we have the follicles surrounding and nourishing the egg. Boom. Right in the middle of the month, in fact, this is how we define the middle of the month. The middle of the month is called ovulation, and that's when the egg is released. The egg is matured, and the egg is released. That is called ovulation. So ovulation should be occurring right about day 14. So we had the follicular phase. The follicular phase is when we have the first half of the month, and what's happening in the ovary? It's nourishing and developing that oocyte. You don't have to know, let me go back to green here. You don't have to know these particular subphases. Just keep it simple. Within the ovarian cycle, what's happening in the ovary each month, the first half of the month is considered to be the follicular phase because this is where the follicles are helping to develop and mature the egg. At the midpoint of the month, around day 14, we have something called ovulation. And ovulation is when that egg is matured and it is released. And hopefully the fimbriae of the uterus catch it, which they usually do. The second half of the month is called the luteal phase. And in the luteal phase, the ovary produces something called the corpus luteum. And this is where the luteal phase gets its name, because corpus luteum, luteal phase. So the first half of the month, the ovary is producing the egg, then it spits it out. The second half of the month, just as important of a job, is the luteal phase. And what the corpus luteum does is it causes a release of sex hormones, specifically estrogen and progesterone. That's just as important. So for the second half of the month, the corpus luteum is going to be producing and releasing estrogen and progesterone. Here we have a chart. I suppose looking at this, it makes it look more complicated than it needs to be. But let's just get ourselves situated, because we're going to see a chart that's similar. At the top, we see the timeline. So these would be days of the month. So if you look at the ovary, the ovarian cycle, we're talking about what's happening in the ovary. Well, for the first half of the month, we are in the follicular phase. So for approximately days 1 through 14, we have the follicular phase. The follicles are helping to produce and mature the oocyte. In the middle of the month, we have ovulation. This is where the mature egg is released. The remaining half of the month, approximately days 14 through 28, we have the luteal phase. And this is where the corpus luteum forms and will release hormones. So it's really what you need to know. Now, at the bottom, you can see that I have added hormone activity. But don't stress. You don't have to know all of those hormones. What I've included here are some pictures. You don't have to know these. This is just an idea of how the follicle surrounds the maturing egg, and then how at ovulation the egg is released. Okay, here. I like this picture. And I like it for mostly one reason. So here's a different way of looking at it. Here we can see the ovarian cycle. So we know that we're talking about what's happening in the ovary. And we can see the days of the month. And we can see, like we already know, the first half of the month is considered to be the follicular phase. And the pictures show us very well that in the follicular phase, the follicles are helping to develop and mature the oocyte. We can see at the midpoint of the month, we have ovulation when the egg is released. And then the last half of the month is the luteal phase, where we form the corpus luteum. So now we have our bearings. I like this picture because what it shows, let me get a different color. How about pink? Let's do pink. What this shows is the undulating hormones. So I know that people like to joke, oh, women are so hormonal. Well, the fact is, all of the events of the sexual cycle are dictated by hormonal release. And it's not just one. In the male, it's pretty streamlined. Males will have a release of follicle-stimulating hormone and luteinizing hormone from the anterior pituitary gland, which travel down to the testes on an ongoing basis. And FSH and LH will trigger the testes on an ongoing basis to produce sperm and release testosterone. It's an ongoing, steady state kind of thing. It is the complete opposite in the female. Because there's many more working parts, and we have to have these working parts happening at the right time. So something has to happen in the ovary here, but then a couple days later, that's where we need the uterus to do this. So there's much more of an orchestration. And because of that, hormone levels are undulating pretty wildly. And that's why I like this picture. So it would be no surprise that at the beginning of the follicular phase, we would see a higher release of follicle-stimulating hormone. We don't need that much of an increase in the females, but it is no surprise that at the beginning of the follicular phase, we're going to see a release of follicle-stimulating hormone. And if I go back to this slide, I'm only going to circle the hormones that you need to know. And it should make sense. If you understand what's happening in the ovary, and if you remember the functions of each of these hormones, it should make sense. So during the follicular phase, I talked about follicle-stimulating hormone. So at the beginning of the follicular phase, we're going to see a release of follicle-stimulating hormone. Wouldn't that make sense? During the follicular phase, we want a release of follicle-stimulating hormone? Yeah. But then I want to go back to this picture because I want to look at the surge in luteinizing hormone. There has to be an endocrine signal. What is it that triggers release of the egg? A massive spike in luteinizing hormone. So this just gives you an idea, right? Look at the massive spike that has to happen in luteinizing hormone. That happens at ovulation because that is the release of luteinizing hormone is exactly what triggers, it tells the ovary to release the egg. So if I go back up here, I'm going to circle that. ovulation. What is causing or triggering the release of the egg? Luteinizing hormone. Triggering ovulation. So, when someone says a woman is hormonal, actually they're saying the right thing, because we have a massive surge of different hormones, and this is just the beginning. But it has to happen this way in order to orchestrate all these things to happen when they should. All the other stuff here is extra. Let's see. I do want to point out here, let me go back up here. Let's go back to green. I do want to point out the luteal phase. So we know that in the luteal phase, it's when the ovary produces the corpus luteum. And you can see here the function of the corpus luteum is to secrete estrogen and progesterone. So a reminder of the function of the corpus luteum: produces estrogen and progesterone. Now, there's always going to be an if. When we talk about the female sexual cycle, there's always going to be an if. So if the egg is fertilized, so if after ovulation, when the egg is released, if the egg is fertilized, apparently I can't talk at the same time. If the egg is fertilized, then the corpus luteum stays. So if the egg is fertilized, then the female is going to go in a different direction. And the corpus luteum is going to stay there for about 9 months, because the corpus luteum is going to be needed to help produce hormones that are going to help nourish the developing fetus. On the other hand, if there's no fertilization, then the corpus luteum basically dissolves. It degenerates. So if there's no fertilization, we don't have to develop a fertilized egg, then the corpus luteum dissolves. And then guess what? The following month, it will be made again. So if there's no fertilized egg, every month, the ovary will produce a corpus luteum to release estrogen progesterone. If there's no fertilized egg, then the corpus luteum will dissolve, degenerate. And then the next month, it'll form again, dissolve. Next month, form again, dissolve. The only time it sticks around is if the egg is fertilized. Oh, okay. This is just a reminder of the relationship between the pituitary gland, because we know already that's where luteinizing hormone and follicle stimulating hormone. I didn't talk about gonadotropin releasing hormone, so you don't have to know it. This is extra, but just a reminder. Okay, so now that we've established what's happening in the ovary, let's shift gears and talk about what's happening in the uterus. And what's happening in the uterus, as I said before, uterine wall thickens. Uterine wall thickens in preparation of a fertilized egg. So every month, that inner lining, the endometrium, thickens. Now, let's play the if game, right? If egg is fertilized. I'm going to talk about this more with the other pictures, but let's just make sure we lay it out now. If the egg is fertilized, then the uterine wall stays thick, stays thickened, and it, how can I say this, cares for developing a fetus. But what if the egg is not fertilized? What if there's no fertilization, which of course is the more common thing? If you think about the course of a woman during her reproductively active years, even if she has some kids, every month, usually there's not an egg that's fertilized. If there's no fertilization, then the uterine wall sheds because it doesn't need to be thick anymore. There's no fertilized egg. Because here's what the uterus is thinking. I mean, if it could think. The uterine wall is thickening in preparation. It's hoping for a fertilized egg. Because a fertilized egg may happen at any time, that uterine wall has to be prepared. Even though it usually doesn't happen that a fertilized egg comes through, sometimes it does. So the uterine wall has to be ready. And the only way that the uterine wall can be ready is if it's thicker. And that specialized endometrium, that inner lining, is thickened and prepared. So it's hoping for a fertilized egg. But what if there's not a fertilized egg? If there's not a fertilized egg, then there's no fertilized egg to attach to the uterine wall. And there's no need for the uterine wall to be thick. And if there's no fertilized egg, then the uterine wall will shed. And I'm going to use red. If the uterine wall sheds, that's when there's menses or a woman's period. So, ladies and gentlemen, a woman's period is the uterine wall shedding and just coming out through the vaginal tract. So imagine, gentlemen, every month that a woman is not pregnant, the uterine wall sheds. And part of that tissue that sheds from the inner lining of an organ, imagine the inner lining of an organ shedding and just coming right out. That's what it is, gentlemen. Let's just call it what it is. Okay. So if we look at the menstrual cycle, again, we can see for the menstrual cycle, we're talking about what's happening in the uterus. And here we have the days. The first, see, it's a little bit different here. Let me go ahead to another picture, and I'm gonna come back to this. So let me go down to this picture here, because this picture does a reasonably good job, actually a pretty good job. So here we have the menstrual cycle. What's happening in the uterus? Down here, this is referring to the thickness of the endometrium. So as we can see, throughout the middle of the month, towards the end of the month, towards the middle and end of the month, the uterine wall thickens. It begins as something called the proliferative phase, and it continues to something called the secretory phase. But you don't have to know those terms. I would like you to just know at the middle and towards the end of the month, the uterine wall is thickening in preparation for the fertilized egg. So if I were to go up here, we could say that in the middle, so from here to here. So if I were to say between here and here, uterine wall is thickening. Uterine wall thickens. You don't have to know the names of the phases. Just know that in the middle, towards the end of the month, the uterine wall is thickening in preparation for the fertilized egg. What is the hormone that signals this to happen? Progesterone. So you can see that when we have our highest levels of progesterone, that's when the uterine wall is its thickest. So again, all of these actions are happening at the same time, and they're driven by hormones. So we can see and imagine, once we put it all together, what's happening with the ovary. We had a release of follicle-stimulating hormone, luteinizing hormone. Then we had a sudden surge of luteinizing hormone during ovulation. At the same time, we've got some estrogen or estradiol being released, and then a sudden surge of progesterone towards the middle to end of the month to the uterus to signal it to thicken. So remember, you only have to know, I keep doing that, you only have to know the hormones that I'm circling. So what's going to trigger the thickening? What's going to trigger the biggest thickening of the uterine wall? Progesterone. Now, if there's no fertilized egg, then what's going to happen? We have a premenstrual phase towards the end, but then if there is no fertilized egg, then we have the menstrual phase. And this is where there is the period, where the inner lining sheds. So if a woman gets her period, she knows she's not going to be pregnant, because that's a signal that the endometrial wall, the uterine wall, is shedding. And they're showing that here. Even though it shows that there is a beginning here, we only actually have a release of blood during the menstrual phase, which is actually the first couple of days of the month. So even though it shows that some of the uterine wall begins to shed at the end of the month, it only actually starts to be released from the body at the beginning. So that's what you should know. You should know that for the middle to the end of the month, the uterine wall thickens in preparation for a fertilized egg. And the biggest endocrine signaler of that endocrine wall thickening is progesterone. If there is a fertilized egg, then that endometrial wall will stay thick and it will nourish the fertilized egg. If there's no fertilization, then that thickened wall will begin to shed, and it will start to be released by the body at the menstrual phase, when there's actually a period. And that's how we know that the sexual cycle begins. So if a woman was trying to ever count her cycle, trying to figure out where she was, we would know that day 1 begins at the onset of the period. Okay. Some extra material here. Let's see. What I want to do is I want to get to this one. So I'm not trying to confuse you, but I want to make sure that we're clear. For the sexual cycle, the ovarian cycle, what's happening in the ovary, and the uterine cycle, what's happening in the uterus, they happen concurrently. So at the same time, the first half of the month, at the same time as the follicles are preparing and nurturing a developing egg, we may have the thickened wall of the uterus being released. Happens together. At the same time as the luteal phase is happening and the corpus luteum is formed, this is when the endometrial wall is going to be its thickest. And I want to point out that it makes sense. After ovulation, so once the egg is released, we know that the egg is released at ovulation, which is typically around the midpoint of the month. Wouldn't it make sense that right after the egg is released, that is when the uterine wall is reaching its thickest? Yes, because the egg is released from the uterine tube. The egg is released from the ovary, travels to the uterine tube to the uterus. So we want, if that egg is fertilized, the next couple of days that it actually reaches the uterus, if that fertilized egg gets to the uterus, a couple of days after ovulation, we want the uterine wall to be at its thickest because it's ready. Okay. Let's see. You can, like I said, we're not going to cover much about pregnancy and childbirth just because we have enough to know. I do want to point out a couple things. I didn't mention this before, but let me go back. People commonly ask me, how long does it take for the egg to travel from the ovary to the uterus? Usually it takes 24 to 72 hours. So you should know that. The time it takes for the egg to get from the ovary to the uterus. And this is actually the window of fertilization. So if a woman is trying to get pregnant, wouldn't she want to try to get the sperm in right after ovulation? So really that window for when the sperm can actually meet the egg is about 24 to 72 hours. It really depends on the person. Kind of amazing to think about all the pregnancies that happen when the window of fertilization is often very narrow. So it says here that the window of fertilization is about 24 hours. It depends. I would say it could be anywhere from 24 to 72. Depends. On a previous slide, if you look back, you'll see that I have a little note. If a woman wants to track her cycle for pregnancy reasons, she'll track the release of luteinizing hormone. You can do a little pee test on a stick that's meant to show levels of luteinizing hormone. And when luteinizing hormone is at its highest, we know that's when fertilization, or that's when ovulation is happening. So a woman, if she's trying to get pregnant, if she has a surge in luteinizing hormone, that tells us that she's ovulating. And the next 24 to 72 hours, that's her window of fertilization. Sperm. When semen is released at ejaculation, let's say that there's just a little bit over a teaspoon that can be discharged into the female, but that little teaspoon can contain 200 to 500 million sperm. But it has to be that many, because most of that sperm, even though it's swimming, is not going to make it up to the uterine tubes. Maybe only 1% of that 200 to 500 million sperm is going to make its way up into the uterus. You can see the picture here on the right. This gives you a nice visual. The big yellow ball is the ovary, of course the biggest cell in the human body, and the small little guy is the sperm, smallest cell in the human body. Another barrier to actually fertilizing the egg would be that when a sperm reaches the egg, that sperm basically blocks any other sperm from coming over. It kind of claims its territory. Okay. The remaining information here is all extra. During pregnancy, the hormones that I described previously really go haywire. So you thought I was crazy before talking about hormones, but imagine during pregnancy. There's so much that has to happen for that fertilized egg to develop. And we can see really crazy levels of hormones going up and down. But this is all extra. You can read about this. You can read about contractions, just extra. I do, just for the nature of public service announcement, again, like to show levels of labor. And then, of course, there's going to be some pictures of the real labor. You know, you saw it. Let's see it. Oh, yeah. There's the crowning stage. So imagine how much that cervix and how much the vagina has to stretch in order for that baby to come out. And here's the head. If I've said this to you before, I'll say it again. Sometimes people use a way to describe this to men. If you want to estimate the size of the head to the size of the vaginal canal and the cervix, you can approximate it to trying to fit a watermelon through the anus. Woo! Big head, big watermelon, small hole. But of course it stretches, but it's, painful. And here's the placental stage coming out after. All right, all the rest here is extra. There's some information about milk. And then at the end, I talk about what could happen when things go wrong. An ectopic pregnancy is when the fertilized egg implants in the uterine tube. And the uterine tube is not structured to withstand that. So the prognosis is poor, meaning that it's not going to happen. You can read about preeclampsia. These are all things that will not be on the test. Someone could develop high blood pressure during the pregnancy and that is called preeclampsia. Could be dangerous, so needs to be taken care of. You can read about birth control, how they work, but will not be on the test. All right, you made it to the end of the semester. Woo! Nice job, everyone.